Good afternoon, good morning, good evening, everyone. My name is Nicole Hoagland, and I'm here representing the Red Cross Red Crescent Global Migration Lab. We'll get started officially in a couple minutes, but before we did, I just wanted to step through a couple housekeeping matters so that everybody can use the platform and participate directly in this panel discussion. You would have seen some slides going through. So for those of you who are interested to use the interpretation, there is interpretation available in French, Spanish, and Arabic, as well as English. On the bottom left-hand corner of your screen, there's a button that says floor. And if you select this button, then you can pick the language in which you wish to listen. It will be simultaneous, so you can stay in that language the whole time. So the presentations, the speakers, you can feel free to ask your question in language as well when it comes time for questions and answers. This is a request to speak meeting, so you won't have access to your microphone and your camera until you request to speak during the time after the presentations when we go to questions and answers. There's also, if you have any technical support, there is a tech chat where you can reach out for help. We have operators on the line to support you in that regard. And also you can feel free to use the message box to chat with other participants, to introduce yourselves, or to note down questions that you might like to ask the panelists after they do speak. I apologize in advance that you may hear a little bit of my voice or see my face today as well, because I will be speaking. But before I hand over to the moderator, I just wanted to give a big welcome and a big thanks on behalf of the co-organizers of this event, and that's the International Federation of Red Cross and Red Crescent Societies, the International Committee of the Red Cross, the Mixed Migration Center, the United Nations Network on Migration, and the Red Cross Red Crescent Global Migration Lab. So with that, I will hand over to my colleague, Ezekiel Simperingham, who is the Global Lead for Migration and Displacement at the International Federation of Red Cross and Red Crescent Societies, to get us started. Thanks, Zeke.
Thank you very much, Nick. And just checking you can hear me okay before you run off the screen.
Yes, can hear and see.
Okay, wonderful. That's a good start. So first of all, welcome, a warm welcome to everyone for joining this event today. I'm very pleased to be the moderator for this event. Nick mentioned, of course, that this is an event that is co-hosted by a number of organizations, by ourselves, the IFRC, by the ICRC, the Mixed Migration Center, the UN Network on Migration, and the Red Cross and Red Crescent Global Migration Lab. So again, a warm welcome to all participants and to all members of the audience for this interactive panel discussion. The title is, it's not all about vaccines. We need to work towards more inclusive policies to ensure access to basic services for migrants during the COVID-19 pandemic and beyond. This will be an interactive panel discussion, and we're very pleased today to have the opportunity to bring together key organizations who are undertaking research on the impacts of the COVID-19 pandemic and related policy measures on migrants, bringing together those organizations who are undertaking that research with practitioners from across the globe. This panel discussion aims to encourage connection and coherence at the national level, at the regional level, and the global level on a very important but quite specific issue, addressing inequity in accessing basic services, including COVID-19 vaccines among migrants. The overall objective of the event today, of this interactive panel discussion, is to strengthen the evidence base for policy development, as well as to promote policies that facilitate and ensure access to basic services, again, including vaccines, for all migrants, irrespective of their status during the COVID-19 response and recovery, but also critically to already start to think ahead towards future public health emergencies. So we are very pleased to have 5 speakers today. As part of this interactive panel discussion, we have speakers representing research, representing policy, representing practice. We have speakers from the Mixed Migration Center, from the Fruit Basket, from the Red Cross and Red Crescent Global Migration Lab, from the ICRC, and from the UN Network on Migration. And we will be pleased to provide a more detailed introduction to each speaker as they have the opportunity to take the floor. The way the event will be run today is we will have the 5 speakers present for around 7 or 8 minutes each, and then we will break for a question and answers. That won't be after each speaker, it will be after all 5 speakers have had a chance to present. So as Nick mentioned, please feel free to provide comments or reflections or specific questions in the chat box. Hopefully you all have figured out how to use that on the top right-hand side of your screen. Please feel free to raise questions or queries or add your comments or perspectives in the chat box as our colleagues are taking the floor and speaking. A note for our presenters today, we are on the Kudo platform, which is a new platform to me and so far seems excellent. One of the features of this platform is there is a timer. So if you see a clock, a timer arise on your screen, that indicates how much time you have left for your presentation. So hopefully you can take note of that and we have time to go through all of the presentations as well as to have an interactive and engaging dialogue. I think with that, we can pass to our first speaker already. And I would like to open the floor for Nick Hoagland, who you already just met. Nick Hoagland has a background in migration policy, and currently Nick leads the Red Cross and Red Crescent Global Migration Lab. The Global Migration Lab for the Red Cross and Red Crescent is a new initiative within the broader international Red Cross and Red Crescent movement. And the current host of this global lab is Australian Red Cross. The Migration Lab is really designed and is seeking to ensure that the voices, the expertise and the experience of migrants and host communities, the communities in which they live, are amplified and guide our policy work, our operational work, and that the research on migration always builds on evidence from people who are directly affected. So Nick, I am very happy to pass the floor to you, if you are there.
Thank you. Yes, I'm just bringing myself back on screen and I will share my screen shortly. 1 second. Oh, just give me 1 second. It's taking a bit of time to open up my presentation. Thank you everyone for your patience with the technology. Are you able to see?
I was able to see it for a moment and now it's disappeared again, Nick.
Okay, give me 1 second. Apologies.
Sure.
There we go. Are you able to see?
Perfect, Nick.
We've got
The
it.
floor is yours.
Thank you, Zeke. And thank you everyone for this opportunity to share a little bit more about the Red Cross Red Crescent Global Migration Lab and the recent work that we've been doing. I'm going to present first a piece of research that we did back in March, which was around access to basic services for migrants, and then speak more to some recent work we've done directly around access to COVID-19 vaccines. So back in March 2021, the lab released a report looking at access to basic services for migrants during the COVID-19 pandemic and the implications of COVID-19 legal and policy frameworks and what that had meant for migrants in terms of how they were able to stay safe, keep healthy, and access support. Now, this report was done in cooperation with 8 national Red Cross and Red Crescent societies around the globe: Australia, Colombia, Ethiopia, Sudan, Sweden, the UK, as well as in cooperation with IFRC and ICRC, so the International Federation of Red Cross and Red Crescent and the International Committee of the Red Cross. The lab, through local partners and national societies, spoke or interviewed or surveyed more than 3,250 migrants as well as over 150 key stakeholders at the community level, at the local level, at the national level as well. And the idea was, as Zeke mentioned, the lab is really trying to build on the credible evidence on the ground and the direct experience of migrants to better understand what issues migrants are facing and to use that to guide and inform policy recommendations. So the key findings of this piece of research were particularly around the inclusion of migrants in pandemic-related support. And what the report showed was that on the ground, often inclusion was ad hoc and reactive. So rather than seeing migrants included from the start in socioeconomic or health policies for support during the pandemic, it was often as a result of continued advocacy and engagement from local actors with government, but also afterwards. So after sort of some of the wider problems we're seeing in the population. We saw that there were often inconsistent measures in place for migrants as compared to nationals or permanent residents, and that some groups of migrants over others were eligible for support. So in certain instances, if you were on a temporary visa or if you were undocumented, you didn't have access to the same type of COVID-19 related support during that time. And health policies were often more inclusive. So there was a shift in policy where COVID-19 testing and treatment was free and available to migrants irrespective of status, but this was more inclusive than socioeconomic policies. And I should say as well, in terms of access to basic services, what the report was really looking at was migrants' access to services such as healthcare, psychosocial support, access to information, protection services, and things like food, water, shelter, and sanitation. So all those services necessary to stay healthy and keep safe during the pandemic. The major barriers that were found in this piece of research related to exclusion based on legal status, inaccessible information, so both in terms of the language, which information was available around how and where to access support, but also the channels through which information was shared, insufficient or unavailable services. So recognizing also that COVID put a significant pressure on healthcare services, and oftentimes because of lockdown and inability to travel, or where migrants were based in rural areas, being able to get to services was often quite a challenge. Financial costs as well was identified as a barrier, and particularly given the impact that the pandemic and related policies had on migrants' ability to work and the loss of jobs and livelihoods. And inconsistent application of relevant laws and policies. And this was, for example, where we saw at the national level, perhaps there was a policy put in place, for example, around people being able to access healthcare services if they had an expired residency permit. In some instances, when migrants would approach to access that healthcare service, the message either hadn't gone through, or frontline healthcare workers weren't necessarily implementing that policy, so people still weren't able to access support. Fear, health, and safety concerns, both related to getting COVID-19 if going out and accessing support, but also fears related to visa status disclosure, for example, if someone was undocumented, or impacts on someone's visa if they were to seek support. And lack of relevant documentation, as well as digital exclusion. As more services moved online and became more remote, there was evidence of a digital barrier for some migrants and migrant communities. Overall, the report really showed that existing barriers were exacerbated, so those that predated the pandemic continued to exist and were amplified, but new barriers also emerged as a result, for example, of people being stranded in countries without safety without safety nets or additional support. In terms of the overall impacts of COVID-19 related policies and limited access to basic services for migrants, we saw a disproportionate impact of prevention and control measures on migrants, and that migrants were also overrepresented in sectors hard hit by the pandemic. So here I've just put a little bit of a snapshot from the full report, and you can see, for example, in Egypt, 80% of migrants who were interviewed or surveyed noted that their jobs were badly affected. In Sudan, 84% experienced the decline in mental health. In Sweden, for example, over 50% accessing one food relief program by the National Society had no stable housing. So real challenges presented in a way that was quite not standalone. So increasing prevalence of insecure housing, increasing food insecurity, increasing mental health and physical health risks amplified, and seeing all of these impacts interrelated and amplified due to the barriers to basic services that were presented. Now, since this report came out, we decided to look more recently into what's happening in terms of access to COVID-19 vaccines. So today we've released a new report with some global insights around access to COVID-19 vaccines for migrants. And this was based on a global literature review and survey among 52 national societies who are working directly with migrants and host communities. And here you can see a regional representation. So we really tried to have a global snapshot to look at how migrants were being impacted across the globe and what was being seen by our national societies working directly with migrant and host communities. And the key insights that the report has revealed is that there are positive trends towards policy inclusion in terms of access to COVID-19 occurring across regions. States are increasingly recognizing the importance of ensuring that everyone is vaccinated and everyone should have access to vaccines to remain safe and healthy. However, there are discrepancies in data at the global level. And what we have seen is, while there's different figures and different data sets, it is clear that access in policy is still far from universal, and some migrants, but not all migrants, have access. So again, it often depends on someone's type of visa status, for example. And ultimately, the barriers in practice remain. So some of the barriers that we already saw in the recent report, the previous report, also are occurring in terms of access to COVID-19. And so when we spoke to our national Red Cross and Red Crescent societies around the globe, some of the most significant barriers are highlighted here. For example, 90% noted that limited information and awareness on how to get vaccinated was a key barrier for migrants, as well as the lacking the required documentation to be able to access vaccination services. Other key areas were around vaccine hesitancy in terms of fear of side effects, fear of arrest, detention, or deportation, and as well as the limited supply of vaccines. So really highlighting some of those existing barriers that are continuing, but some of the key barriers that we need to address at a policy level, but also that we need to address in practice in terms of promoting effective access. Interestingly, financial was not a barrier here, because it is being seen that the vaccine, where it is available free of charge. And finally, just some key recommendations that come out of these pieces of research is around ensuring that policy must translate into practice. And so when we talk about access to basic services for all migrants, the recommendations that are put forward around ensuring inclusion in local and national COVID-19 response policies, having effective access to timely, accurate, and reliable information, ensuring inclusion in testing, treatment, and vaccination policies, and making sure that migrants, if and when they need it, are able to access socioeconomic related support and have safe access to humanitarian assistance without fear of arrest, detention, or deportation. And when we speak about vaccines specifically, the recommendations that are put forward around related to safe and equitable access for vaccinations for all migrants, ideally free of charge, addressing and understanding those informal barriers at the local level. So really look at maybe alternative registration processes, for example, to make sure that all migrants are able to access vaccines in practice, targeted outreach and information campaigns to migrants in channels that are accessible and in language, understanding a little bit more about vaccine hesitancy through research, and prioritizing the most vulnerable based on needs and risks rather than on legal status. And if I have 30 seconds, I might just highlight in practice how this is being done by some National Red Cross and Red Crescent societies around the globe. So for example, the Swedish Red Cross is operating a vaccine bus and invites a vaccine bus from the local health authority, who provides a mobile service to irregular migrants at the center because they're having trouble booking through the digital system. The Gambia Red Cross Society has a vaccination center at its headquarters where migrants alongside others can receive the vaccine. The British Red Cross is working with a local health authority who's arranging pop-up vaccination clinics for undocumented migrants and people in the asylum process, and reaching out and contacting clients to ensure that they can register and access appointments on the day. And the Red Cross of Montenegro is facilitating access for people facing challenges, administrative barriers and language barriers, to help and accompany them to healthcare institutions. And lastly, the Maldivian Red Crescent is helping to register undocumented migrants after doing some advocacy and engagement with the government to help ensure that they have a vaccination registration card to proceed. So some real good examples of how we can kind of link and build on that policy inclusion trend that we're seeing, but make sure that there's effective policy in practice as well. That's all from me.
Thank you very much, Nick. And I think, first of all, as the moderator, thank you very much thank you very much for staying within time. But also thank you very much. I think that's a really important way for us to set the scene for this conversation today. You've provided a long list of policy and practical barriers. You've noted some areas where there are some improvements, but there's still a long list of barriers that we're seeing for migrants. I think importantly, you haven't just looked at the barriers, but you've also looked at the impacts on migrants for who face those barriers. But you've also set the scene, I think, in an important way by providing the start of some recommendations for how we can overcome these policy barriers, how we can overcome these practical barriers, and some examples of where you see that at the global level already happening and starting to happen in practice. Nick, before you go and we pass to the next person, for colleagues who have not seen those reports that you've mentioned, where can they find
Oh,
those
yes.
reports?
I probably removed my slide too soon. You can find them on the Global Migration Lab website, and I will put it in the chat for people to be able to access. I'll do that right now.
Okay, brilliant. Thanks, Nick. I'm sure there's many colleagues who have seen them, but I'm sure some who are very interested to look into more detail into some of those findings and recommendations. And with that, we can turn to our next speaker, and it's an opportunity to move from the global level to more the local level. We would like to welcome Tomas Shamuyarya. I hope I pronounced your name correctly, Tomas. Tomas is the director and founder of the Fruit Basket, which is based in Johannesburg. And the Fruit Basket advocates for the rights and freedoms, the safety and security of LGBTQI+ migrants and refugees living in South Africa. And particularly since the COVID-19 pandemic began, through online appeals and crowdfunding, the campaigns, the Fruit Basket has responded to some of this specific community's most urgent needs. So Tomas, very happy to welcome you to this panel discussion today, if you are there. Tomas, maybe we have a problem with the connection. Tomas, I'll give you a few moments. Otherwise, we may need to come back to you and pass on to the next panelist. Yes, I think so. Okay.
Sorry, Zeke. Sorry to jump in. Tomas, maybe if you can put your camera and your mic on, because I can see he's on the floor.
Maybe we can come back after.
Yeah,
maybe our technical colleagues can help with Tomas, and we can move on to the next speaker and then come back to Tomas. The next speaker is from the Mixed Migration Center. It's Jane Lineker, and Jane is the Global 4MI coordinator. I'm sure many colleagues are familiar with 4MI. Jane coordinates the Mixed Migration Center's 4MI data collection initiative. Jane is also, like me, based here in Geneva, Switzerland, and has a background in analysis and information management within the humanitarian sector. For those who are not familiar, the Mixed Migration Center is part of the Danish Refugee Council and has 6 regional hubs, as well as the coordination unit in Geneva, where Jane is based. Through the 4MI, the Mixed Migration Center speaks to more than 10,000 migrants and refugees traveling on mixed migration routes every year, collecting data on aspirations, the drivers of migration, the details of the journey, and particularly on needs and vulnerability. Jane, sorry to advance you slightly in the speaker order. I hope you are feeling prepared, and you have some slides, I understand, so please feel free to put the slides up, and the floor is yours, Jane.
Thanks very much, and for the kind introduction. It looks like my screen sharing is working. So if you
Very well.
If you can hear me, it's all good. And in a lot of ways, it's good that I come straight after Nick, because a lot of what I say speaks, because of the kind of research that we do, speaks a lot to the findings that she had as well. So thanks for having us and taking the time here. So I'm here to talk mainly about the data that we collected as Forum I at the MMC during 2020. So we did a big data collection on the impacts of COVID-19 on refugees and migrants. But the data that we collected then is still very pertinent to the situation today. The main message being that COVID-19 and the measures taken to respond to the pandemic have multiplied and intensified existing stresses for people on the move. Let me see if I can move my screen. There we are. So to quickly take you through what I'm going to talk about, a quick overview of vulnerabilities, risks and dangers experienced by refugees and migrants, then to look at access to services, information, health, housing, education, and to finish off with needs. I'm going to look at data at the global level, but the data comes from our Forum I interactive dashboard, and you can access that yourselves if you're interested in any particular population for the audience. And throughout the presentation, there are some quotes from respondents which give some of their personal insights on how some of these things affected them. But before I start, maybe we should look at how we did our data collection. So we conducted over 23,000 interviews between April 2020 and February 2021 in 17 countries. We interviewed 15,000 men and over 8,500 women. Here you've got a little bit of an idea of where that data collection was done. Because normally Forum I consists of face-to-face interviews with refugees and migrants traveling across mixed migration routes around the world. Obviously, we had to suspend our regular data collection, but it was extremely obvious that this would lead that there were massive information gaps and that a lot of people were stranded and we didn't know what was happening to refugees and migrants on the move. So we quickly determined a new way of conducting interviews by telephone and recruiting respondents remotely. And we developed a survey focused on the impact of COVID-19 and responses, and of the responses to COVID-19 to fill some of those information gaps. So this is what we ended up with, and that's what I'll be presenting today. So yeah, the key message is that COVID-19 was multiplying the stresses of an already stressed population. Refugees and migrants have been stuck. The risks of exploitation and abuse have grown. Most of those who told us that they had been receiving an income had lost income. And particularly at the beginning, there was a reported increase in racism and xenophobia, particularly in Tunisia, Malaysia, and Somaliland, among the countries where we conducted data collection. And just as an example, we are asking people how far they agreed with these statements. There's been an increase in domestic violence, an increase in sexual exploitation and of labour exploitation. You can see that there's a good half of the respondents agree with an increase in domestic violence. The increased risk of labour exploitation is higher even than that, and sexual exploitation is slightly lower, but if you then disaggregate that by gender, the proportion of women saying that there's been an increased risk of sexual exploitation is much higher. So that's a kind of background of the risks that were going on, and a focus on income loss here. So of those that we interviewed who were receiving an income, 63% had said they had lost income through loss of work, and only 20% said they had not lost income at all. Then moving to access to services, we thought I'd start with access to information about COVID-19. So we asked who you got information from, and most people reported somebody. They were getting information from somewhere. And what is pretty nice from these two charts is that you can see that the most trusted sources of information were among the key sources of information, but there's still some gaps. For example, health professionals were the most trusted source of information, but they weren't the most frequent sources of information. And another thing that I think is worth drawing attention to, especially with all the misinformation, which has been for everybody, not just for the population that we're looking at, is the dependence on the online community as a source of information, which is the second highest response in terms of source of information on COVID. And this is pertinent when we look at access to other services further along. So if we move to access to health services, the perceived access to health services is not extremely high. It's a minority that say that they do have access to services. There's quite a large who don't know, and the no is fairly high. So we asked both about access to services if you had COVID-19 and if you had urgent other health needs, where there seems to be slightly more confidence that there is access to health services. And what is interesting and reflects a little bit what Nick was saying, that there's been an improvement in access observed over time among our survey respondents in Asia and in Latin America, if not other regions. When we ask what the barriers to access are, the predominant one is money, lack of cash to be able to afford the fees to get health services. But other important barriers are discrimination and fear of being reported. So worrying about their status and not wanting to approach health services because of that. Another big barrier, which was particularly the case amongst respondents in Colombia, is lacking documentation to be able to access health services. If we move to housing, there's only half, I say, that they have housing where they can keep isolated and keep safe distances from people. There's quite a gendered element to this when we looked further at the data. So single men frequently living many to one room or to small accommodation, so they're unable to follow health protocols, and this was particularly the case regarding sanitation and having to share sanitation facilities. But women also often reported that they cannot comply with COVID-19 prevention measures due to their living conditions. In Colombia, again, there was a lot of concern about rental arrears and evictions, and a moratorium was placed on evictions, but they continued despite the moratorium for a number of people. And there were reports of the situation worsening as soon as the moratorium came to an end. And then access to schooling. So it's a fairly bad situation to start with. As you can see from the data here, 38% of those we interviewed with school-age children did not have children in school before COVID-19. Then after that, another 29% of those who had kids in school said that they had lost access. So as we said, the situation is worsening, and this varies a lot according to countries. So you can see there a little bit of a breakdown among the respondents from the different countries where we conducted interviews. Very high numbers in Niger, although the sample was quite small, and lower in Colombia. And finally, to look at needs for assistance, we had vastly increased needs for assistance. You can see 85% of people said that they were in need of extra help. Unfortunately, only 32% said that they'd received any extra help. And to some degree, when we ask what kind of help you needed versus what they received, there's some reassurance in that the needs were for basic needs, and these are the kind of needs that are being covered. But then there's still quite some disparities. So there's a lot less cash provision compared to those who said that's what they need. Access to health is a fairly high need, but that's not what was being received by people. But more than that, it's the scale of provision that is the difficulty, as we saw in the previous slide. So there's a kind of overview, very quick, global, of the kind of impacts of the pandemic on the population on the move. Since March 2021, we've started collecting data in a more general way, as we used to, about people's journeys. But we have included the impacts of COVID-19 in a couple of questions, and we're looking at COVID-19 as yet another stressor and driver and factor having an impact on people's journeys. What's pertinent to observe already in 2021 is that border restrictions are still most often reported as a COVID-19 impact. As you can say, 55% of people mention that, but there's still a large number of people saying that risks related to the journey have increased due to COVID, and a fifth still finding goods and rent unaffordable. So access to the basics are difficult. And 12% of people are still stuck. So that sort of concludes the findings that I wanted to present here today. We're continuing to monitor the impact through these questions. And what's important to note, I guess, is that the impact is far from over, and it's widespread, and it's multifaceted. And yes, it's very much about vaccines, and what we have to say here is relevant to the vaccine access, but there's a lot more in that too. Thanks very much for listening.
Thank you very much, Jane, for, I think, an excellent overview and presentation. I agree, it fits in nicely after Nick's presentation. Some of the findings are alarming, Jane, and I think you've made a good point there that we need to address these now, but also take stock to make sure that this is not the case in future public health emergencies, or indeed more broadly. Some of the findings you have there are not solely related to health, but it's about housing, it's about education, it's about inadequate access to education that pre-existed COVID. And something that we heard a little bit about a while ago, but seems to have dropped off the radar, is this concept of building back better at the end of this pandemic. And I think some of the structural issues you've highlighted there need to be on our radar long after COVID-19 pandemic has ended. So thank you very much, Jane. I'm not sure if we managed to find Thomas, or if he managed to reconnect. If Thomas, if you are not there, we can move on to our next panelist and then come back to you either after that or after the final panelist. We're very pleased to now pass the floor to the ICRC, specifically to Dr. Angela Contraneo. Angela is the Global Advisor for the ICRC on migration issues. Previously, Angela was the Global Advisor on internal displacement for the ICRC and has worked for ICRC operations in many different countries and contexts, including Serbia, Colombia, Kenya, and Sudan. Dr. Contraneo holds a master's degree in political science from the University of Florence and a doctorate in international law from the University of Rome. Angela, we've jumped past Thomas, but hopefully you are also ready to follow Jane, and the floor is yours.
Thank you very much, Ziki, and hello to everyone from Geneva. I'm really pleased to have this opportunity to talk to you about this report, As If the War Was Not Enough, which is based on real life experiences documented by ICRC teams in the field from March to December last year. I've put on one only slide so that you can see the cover of the report as I speak. Let me start by explaining why the ICRC produced this report. So, as you know, armed conflicts have not stopped because of COVID-19. And for war-affected people, COVID-19 is just one threat among others. So it's a crisis on top of other crises, exacerbating pre-existing humanitarian needs, as well as creating additional vulnerability. So we at the ICRC wanted to understand better how the pandemic has affected the lives of people who were caught up in conflict, as well as those who are fleeing conflict, either internally or across borders. And the report contains 8 personal stories which illustrates the pandemic's impact on the protection of people affected by armed conflict. Through these stories, the report reflects on policies and approaches that have been adopted to respond to the pandemic, and tries to highlight lessons learned as well as emerging good practices to inform future efforts by governments, humanitarian organizations, and other stakeholders. One of the personal stories of the report is particularly relevant to our conversation today. So I'd like to summarize it for you and then to focus my presentation on what we can learn from this story. It's about Jawid, who left Afghanistan with his sister and his aunt in January 2019, as they continue fighting and insecurity in the countries was making life difficult for civilians. They set off a long journey through Iran, then Turkey, and ended up in Moria on the Greek island of Lesbos. The report tells us about Jawid's long wait for an asylum interview, as when COVID-19 hit Greece, then all the interviews and procedures linked to asylum claims were frozen. And then his interview got cancelled again and again, because first the camp got locked down, and then, as we all know, it was destroyed by fire. And we read about how Jawid felt as if he were suspended in time, and the uncertainty and the stress created by this uncertainty about his future. In the end, Jawid got his interview in November 2020. That's when our team on the ground collected his testimony for this report. So what can we learn from this story? I think Jawid's story is really a powerful illustration of some key protection concerns affecting migrants, including refugees and asylum seekers worldwide during the pandemic. And I would like to highlight here 3 issues. First of all, Jawid's experience really speaks to the specific vulnerabilities affecting migrants living in camps and camp-like settings, as well as those held in immigration detention. Migrants in such setting are, first of all, particularly vulnerable to the spread of the virus. We all know, due to the overcrowded conditions, insufficient hygiene, and also problems of lack of access to health information and health services. But what the report also underlines is that migrants in these settings have also been particularly affected by restrictive measures adopted by some governments to contain the virus, such as, for example, the application of lockdown measures to entire camps, or the use of a combination of quarantine for newcomers and access restrictions for staff, both in camps and immigration detention facilities. These measures have not proven in the end to have a lasting health benefits, but they did, in fact, contribute to a migrant sense of isolation, and have undermined also their access to services available only outside of the site, such as secondary healthcare or legal and social services for migrants held in immigration detention. At the same time, there have also been progressive approaches with governments who have released, for example, people from immigration detention. They have suspended arrest of migrants without valid status, used non-custodial measures to decongest facilities, or opted for temporary regularization of migrants, or the automatic extension of the residence permit for the duration of the pandemic. Other good practices have been the decongestion of camps, with the relocation of particularly vulnerable individuals, such as an unaccompanied minor, for example, in order to place them in more suitable accommodation, and the development of contingency plans consistent with the public health guidance, both in camps and in immigration detention facilities. And of course, the ICC has encouraged all these positive practices. My second point concerns the plight of of people fleeing armed conflict and violence and seeking safety and protection abroad, which is also highlighted by Jawed's story. As mentioned in the report, several governments have developed innovative and solidarity-based solutions to manage to try to reconcile public health measures on the one hand and their obligations under international law on the other, particularly when adopting emergency border measures. For example, some governments have adopted border management procedures limiting health risks such as a medical screening or testing upon arrival. And some have also suspended the forced return of irregular migrants to help prevent the spread of the virus. At the same time, however, we've also observed problematic practices that have been applied and that have had a negative impact on access to international protection, such as the use of blanket border closures without safeguards in place to ensure non-refoulement. And at the same time, yes, this practice has been so problematic, and the ICC has really tried to stress the importance of maintaining access to asylum as well as humanitarian exceptions to travel restrictions. Finally, the story, of course, serves also to remind that migrants have been often among the most vulnerable population, be they in camps, in immigration detention facilities, in urban areas, or caught in armed conflict, and particularly those in an irregular situation. I think that both Nick and Jane have really already well described the different specific vulnerabilities, from concerns related to safe access to services, to the stigmatization, risk of exploitation, etc. And I would also like to stress the risk of resorting to harmful coping mechanisms due to the loss of income as an indirect impact of the pandemic. Let me conclude by highlighting two policy messages that are contained in the report. The first one is prioritize community engagement. This is, of course, key to increase understanding of the multiple dimension of vulnerability and of people capacities for resilience, so that then this understanding can inform contingency plans and crisis response measures, and we can adapt these measures to the specific circumstances of migrants. The community engagement is, of course, also key for trust building, to prevent misinformation and disinformation, promote social inclusion and integration, etc. And the second key point is, so as also the Migration Lab report highlights, there have been inclusive and innovative approaches that have been taken in on an ad hoc basis during the pandemic. So the message would be translate these ad hoc but positive approaches into more long-lasting policies to strengthen resilience of vulnerable groups, including migrants, to health risk and to social economic hardship. I think a positive thing that really has come from this pandemic is the fact that there have been more and more awareness on the part of many authorities of the need to remove obstacles for migrants' access to services, in particular to healthcare services, not only to reduce the impact of the pandemic on migrants themselves, but also in the interest of public health management. So the pandemic has really shown that migrants' inclusive responses, as well as responsibility sharing among states, offer benefits not only to the migrants, but also to the entire communities. And this, of course, is also valid for access to immunization. So I would say, let's capitalize on these, and let's keep on stressing the need for more empathy, as well as for more inclusivity in dealing with migrants. Thank you very much.
Thank you very much, Angela, for the excellent presentation and extremely interesting analysis and findings. Thank you also for reminding and encouraging us all to have engagement with the communities who are affected by these issues at the heart of all of our work, including all of the policies and programs that are developed. You've reminded us it's the knowledge and the capacity, but also the trust that flows from that that's absolutely critical. And thank you for also reminding us of some of the aspects that might not be so visible to some of us working in different areas. For example, where borders are closed to protect public health, how does that impact on the possibilities to access asylum or other mechanisms of international protection? And where do those border closures, although designed to protect public health, amount in some cases to refoulement? And also you made an interesting observation about the possibility for humanitarian exceptions to some of these restrictions. So Angela, maybe you've already gone, but if you wouldn't mind just putting a link in the chat to your research from ICRC, I'm sure there are many colleagues on the line today who would like to go into some of those findings and some of that analysis in more detail. So if you don't mind popping that in the chat, then I'm sure many colleagues will appreciate that. I have just seen that Thomas is back and connected, which is wonderful news. Thomas, I'm not sure if you heard it, but we provided a brief introduction to who you are, the founder and director of the Fruit Basket, and your work advocating for the rights and freedoms and safety and security of LGBTQI+ migrants and refugees living in South Africa. Thomas, I hope we can see you well. I hope we can hear you well, and I would like to pass the floor to you. Thank you.
Thank you, Zik. Am I audible? Can you hear me?
We can hear and see you very well.
All right, sure. Thank you. I keep getting this message that my connection is unstable, but I hope it doesn't stop me. So, hello, everyone. Thank you very much for giving me this opportunity and platform to speak about the work that I do and also the challenges that the community we serve faces. My name is Thomas Shamiarira. I am a transgender man from Zimbabwe, and I am living and working in South Africa. I've been living here for the past 10 years. I am the founder and executive director of an organization called the Fruit Basket that supports LGBTQI+ migrants, asylum seekers, and refugees. The Fruit Basket fights for refugee inclusion in programs and services here in South Africa. The community that we serve belongs to multiple minority groups. They're people of color, they're LGBT, and they're refugees. Racism, xenophobia, and homophobia are a part of our everyday life. We faced these challenges before the COVID-19 pandemic and had lockdowns and many other challenges, but the pandemic came with many more challenges. And life has been so difficult and unbearable. Not only are we excluded from services, we are also not able to do the menial jobs that allow us to put food on our tables and roofs over our heads like we normally do. Most members of this community are undocumented, meaning they can't get jobs. So they all work in the informal sector. But due to the lockdown and its restrictions, they cannot be on the streets selling or hustling. And since all of this started at the beginning of 2020, the number of people reaching out to the Fruit Baskets are increasing every day. We underestimated the numbers, and now we know that more research has to be done so that we can know the actual figures and also the needs of this community. At the moment, we are focusing on doing relief work, just providing practical solutions to the challenges that this community is currently facing. Homelessness is also a big challenge. So we are doing a housing and feeding relief program. We are just but a small grassroots organization and do not have the capacity yet to do these relief programs on a bigger scale. But we are doing our best to make sure that the members of our community are not in the streets and hungry. And as you all know, xenophobia is a very big problem here in South Africa. So our members being in the streets and them being LGBT as well is just a recipe for disaster, which is why we are doing the work that we are doing to just try our best and make sure that nobody finds themselves in the street, or if we get a message to know, or if we get to hear that somebody is on the streets, then we do everything that we can to make sure that we get them off the streets as quickly as possible. So with the award money that we received from the UNHCR, we're giving members of our community cash and food vouchers, because most of our members work in the informal sector. And with the hard lockdowns, they are unable to work. And they have all lost income. And there's not many organizations in this country that caters or serves this particular community, which leaves the fruit basket and a few other individuals as the only people that focus on this community alone. And we're doing fundraisers and asking for donations from our friends and allies, and also just reaching out to different funders and asking for emergency support. Other LGBTQI+ organizations here in South Africa are also supporting us where they can. And I must say, the only good thing that has come out of this pandemic is that it has allowed us as the LGBTQI+ community, citizens and refugees alike, to just come together and support each other. But pandemic or no pandemic, the biggest challenge that we face here in South Africa is documentation. Most of the people, and I can say more than 90% of the LGBTQI+ migrants and asylum seekers community is undocumented. And they're living here illegally, which puts them at more risk. And they are undocumented, not on purpose, not because they want to break the law, but the asylum process or the system is just so complicated, next to impossible if you ask me. And it's as if it was designed to just keep everybody undocumented and living here illegally and, you know, as criminals, because the few people that have attempted the process have had such a very bad and terrible experience that the rest have not even attempted because they are afraid of even approaching or getting close to the refugee reception officers because of the experiences of the few that have attempted it. But most of the challenges, or I can say all of the challenges that this community faces, they stem from their undocumented statuses. You cannot get a job, you cannot get access to any services if you don't have papers. Because if you go to a public hospital, the first thing that they're going to ask for is your documentation. And if you don't have that, it means you're not going to get the service. So if this asylum system or process can be fixed, I think things will start to change for this community. And also, refugees are still arriving in the country because situations are getting worse and worse in all countries and different countries, and everybody's just running to a place where they think they can find the greener pastures. And at the moment, the refugee reception offices are still closed, and we have no idea when they will reopen, which puts people at more risk again, because the chances of people getting into trouble at this point during these lockdowns are very high, because there's curfews, there is so many restrictions that one can easily break, and they find themselves on the wrong side of the law. And right now, at this moment, as I'm speaking, one of our members was arrested for breaking the curfew by just a few minutes, because they were in an Uber and the Uber driver could not get into the area where they stayed. So he was dropped off somewhere, and as he was walking to his house, the police got him and arrested him. And this person is a transgender person, and this person is undocumented. They are not South African, they are a refugee, an asylum seeker. So this issue, I don't think I even need to explain. It's obvious how difficult and how complicated it is, because apparently breaking curfew is grounds for deportation. And this is a transgender person. They cannot go back to their home country. So this I mean, makes it very clear to know that many of our members are going to get into trouble because they have to go out to the streets to hustle so they can put food on their tables. And whilst they're doing that, they might get arrested because they might be breaking one restriction or another. And like I mentioned earlier, majority of the members of this community are undocumented. And these are just a few of the challenges that we are facing right now. And the Fruit Basket being a grassroots organization, we know what the challenges are, we know what the problems are, but we don't really have the capacity to assist or to do more to help our community, the community that we serve. But yeah, we are doing our best, and we're gonna keep doing our best. So at this point, if more focus can be put to us as the refugees, LGBTQI plus refugees community, and our needs, I think that would really be helpful. But documentation at this point, and also like before the pandemic, was the biggest issue and will always be the biggest issue. And yeah, that's what we need as an organization to work towards, and also just find practical solutions for that as well. Yeah, thank you so much.
Thank you so much to you, Thomas, and I'm extremely glad that you were able to reconnect and that you persevered with the technology to be able to share such an important situation that's unfolding right now, and the work of the organization that you founded and that you direct to support a community so directly affected by this pandemic. But I think, Thomas, you've also highlighted the more important, and not more important, but the bigger and important point, that the situation today that many communities, including the community that you work so closely with, the situation is not just because of the pandemic. It's not just because of the impact of COVID. It pre-existed that. And in many ways, the COVID-related measures have shone a spotlight on the pre-existing challenges, the pre-existing structural factors that had created risks for community before COVID began. We would like to now turn to our final speaker from the panelists. A reminder to all members of the audience, please feel free to write a question in the chat box. Please feel free to make a comment. I'm seeing that some questions are already starting to come through. Please feel free to make a comment, a reflection, an observation from your perspective. And just to say that after this presentation, we will then have a chance to have questions and answers. So we may need a reminder of how to take the floor, but I think from memory that you just need to click request to take the floor, but we will have that after our last speaker. And so welcome, Dr. Kanakporn. To us, we know you as Jum from the WHO. Dr. Kanakporn is in the health and migration program, where she works as part of the Office of the Deputy Director General. Jum is responsible for regional and country support and partner coordination since April 2016. Jum importantly also co-leads very well, I can add, the working group on access to services as part of the UN Migration Network, as well as the vaccination and health related activities of the thematic priority on ensuring inclusion of migrants in the COVID response and recovery. Before this, Jum, Dr. Kanakporn, worked in refugee and migrant health programs since 1984 at the subnational level, at the national level, at the regional level, and now at the headquarters level. Jum has worked with IRC, the International Rescue Committee, with UNHCR and WHO, serving refugee populations in Bangladesh, in Jordan, in Myanmar, in Pakistan, in Sudan, and Thailand. Welcome, Jum. Very pleased to have you with us. You're a close colleague and friend to many of us, and we would like to pass the floor to you now.
Thank you very much, Sik, and hello everybody. Thanks to invite me. Yes, indeed, I wear different hats on the day-to-day with WHO and also with the UN network on migration, of which WHO is an executive committee member. It's the number 9 of the committee, executive committee. We also co-lead the working group on access to services, of which IFRC is also a member of our working group. The group have now been merged with the new thematic priority that deal with different activities. I will all talk about it later. So if I have a couple slides just to set the tone a little bit of the talk today. Yes, thank you very much, Nick. So basically, when we talk about the global compact, so I'm asking here to talk about the role of the GCM, the global compact on migration in providing access to services during COVID-19 and beyond. So basically, just to touch base, next slide, please, Nick. To touch base a little bit on when we're talking about the global compact, I'm sure that many of you know about it. There are 23 objectives in there, and with this one, many of you are dealing with the access to services. So you probably heard a lot about objective 15, provide access to basic services. So with this one, member state in the global compact has committed to ensure that all migrants, regardless of their status, have access to can exercise their human right to safe access to basic services. They also commit to strengthen migrant inclusive service delivery system. So you have heard a lot about colleagues already talk about several research put on it related to access to services, related to policy. So these are in the global compact, and there are a number of sectors or area in there that in this objective 15, health, education, access to legal and council services and all this. So with this one, what you have not heard often is that there are also other objectives in the global compact that also cover on the access to services. So for example, objective 3 on access to information. Objective 4 on proof of legal identity and adequate documentation. Objective 6 on fair and ethical recruitment and safeguard conditions that ensure decent work. So we're talking a little bit more about that later. And objective 7, address to reduce vulnerabilities in migrant. Objective 14, enhance consular protection, assistance, and cooperation throughout the migration cycle. And objective 17 on elimination of all form of discrimination, and objective 21, which is on facilitating safe and dignified return and readmission. So these are all the related objectives with regard to related to the access to services. So next slide, please. So if we are looking at beyond objective 15 beyond other objectives that we just talked about. So when we look at the work of the UN Network on Migration itself, what does it do when it comes to the implementation of the Global Compact? So the UN Network on Migration had been established to support the implementation and follow up and review of the Global Compact implementation. So with this, one member of executive committee is UNDESA, UN Population Department, IO, IOM, OSCHR, UNDP, or UNHCR, UNICEF, UNOCD, and WHO. We also, UN Network also has its extended members, other UN members or other members. So with that, we have about 40. The number are increasing. I don't have the latest number, but minimum for sure is 40 UN agencies and organizations there. So they function the way UN Network work is that it have a work plan. So the work plan, now we are already in the second work plan, and they have the core thematic priorities. Our working group on access to services is just one of the thematic priorities in the first UN Network work plan that expired the end of last year. With this one, we are now with the new work plan, and with this also we have a function. We also have 24 champion countries that help facilitate, or I would say the champion the work of the UN Network, as well as the implementation of the Global Compact. And with this one, of course, we also have national network and also the regional through the various regional socio-economic commission. For example, you have ESCAP, you have ECAC, and you have all of this. So next slide, please. So with the working group on access, the next slide, please. Yes, already, sorry. Go back, please. I'm just too fast. So with our working group here, talking about our working group here, the working group on access to service is co-led by WHO, which is myself, and UN Habitat, with the contribution from member FAO, IO, IOM, OSCHR, UNAIDS, UNFPA, UNICEF, UN Women, Caritas, and on behalf of Child Right, IFRC, and PICUM, and PSI, and UCLG. UCLG is a local authority organization. So with this one, we have been working with our members, and we have produced, I think, during when the pandemic started, what we have produced is, I think many of you have seen, the policy brief on access to services in the context of COVID-19. So with this one, you have the link there to that we have been done, or have been developed by the working group. We also are now working on about finishing and publishing the collection of the best practice or good practice that provided by different member states and different stakeholders. So this is the work that we have been done in the previous work plan of the UN Network. So moving into the new work plan, if you could kindly Nick, go to the next slide. So when it comes to the pandemic, at the time where we start working on this, there was not a lot of data, not a lot of information to come about on the impact of the pandemic on this migrant population. And we're glad to see that many work has been done by the IFRC and other colleagues who have already present. But from our side here, what we see, we have done a number of review. What we see here is that there's a real solid data or evidence coming out. We see that, for example, in some countries, in many countries, we see higher mortalities, higher morbidities, higher in ICU admissions, and that is have impact, severely affect migrant population. We also have evidence coming out, more evidence coming out with regard to the vaccine rollout And with this one, at the beginning, as you know that the vaccination has started from January, and some countries may start a little bit earlier, but from January and now and until now on, at the beginning we don't see much information because this population had been put not as the first phase of the rollout of the vaccine. They go to second, they go to third phase. But what WHO had done is to conduct a study, conduct the review of all of the NDV, the National Vaccine Deployment Plan that have been submitted and uploaded to the COVAX facilities. These are 104 countries that include countries with the country low to middle income countries where would get vaccine at free of charge, and also self-financing countries where they will finance the vaccine themselves, but they participate in the COVAX facilities. So of this one, what we see, I have not put on here on the slide for you, is that what we see here is that only 39% of these 104 countries that apply for the COVAX facilities explicitly include refugees and asylum seekers. 28% include migrants, and only 17% include irregular migrants. And with this one, when we look deeper, we saw might be low number of countries that include refugees and why, but actually when we look further in these 104 countries, there are countries that also do not have refugees or have very insignificant number of refugees. So with this one, we look further on that. We use a cutoff of 1 per 10,000 or minimum 500 person per country, and that is a very similar figure. We come up with similar outcomes. With this one, we saw a significantly different in terms of the coverage for refugees. With this one, we saw 94% that have included refugees in their plan. But with this one, probably accounted for or attributed to the refugees that are covered by the 1951 and 1916 the conventions that they have more right than other migrants, and many member states have signed up for that. So with this one, we are working now further with IOM, UNHCR, UNICEF, and IFRC to really monitor what's happening in the country level in terms of vaccination. Now, when we look at on the positive side, what we see here is that, of course, during the last few weeks, few months, we saw more countries, donor countries that come out more to say that, or to commit that they're going to donate more vaccine into low to middle income countries. What we see now is that already 189 of the 194 WHO member states, only 5 countries that now have not started yet the vaccination. So with this one, what we see with the UN network, and we have been guided by the UN network principle, the principle of the executive committee, is to work to concentrate at the moment on vaccination. Of course, vaccine is not all. Vaccine, we talk here about vaccination. When we talk about vaccination, it means that everything comes with it. When we talk about education, information, housing, good water and sanitation, and all this, it have to come together. So we are not omitting other access to services, that activity we have been doing, but we would concentrate here on a number of activity that will come along with. One is on the advocacy side. You have heard already from our IFRC colleague who talking about the improvement. They see the improvement in terms of the inclusion. We also see we could not agree more with that. We see the same trend since our study of the NDVP review, and now we see a lot more countries that include this population. But what we do not see yet is in the irregular migrant in irregular situation. We see the difference very little. 17% at the time we review. We see now only 22% that explicitly include this population. So with this one, there's a lot more to do, and this will be the task of the UN network also to support the global advocacy for the inclusion of this. This will come with the policy brief development, the practical framework on the inclusion, also the technical support to the member state and to partner and to the champion countries, and to support and to where is for webinar. This is this probably could be considered as one of the webinar that we do to promote the inclusion of this population. And then also with this one, knowing that this is beyond also the vaccination and the health measures, the UN network also we include activities. If you could go to the next slide, my last slide, please, Nick. So this one is to look also beyond health and social and public health measures, but okay, sorry, this is my last slide. I have combined the slide. So to also look at the socio-economic impact also on the forced return. So we'll be working on the advocacy strategy to really promote to really work with forced return, those who forced return, work with the government in the reintegration and partner, and also to foster socio-economic integration of migrants in the society for the response and recovery efforts and beyond. So I will stop here. If I go over time a little bit, I'm sorry, Sik, but I give the floor back to you. Thank you.
Thank you very much, Jim. Thank you for the excellent presentation. I think as with the other panelists and speakers, it'd be great if you can share a link in the chat box to some of those activities and some of those resources that you mentioned. Maybe a link to the UN Network working group homepage, or maybe other colleagues can share that link so that members of the audience can find out some more details about many of those important activities that the network and the other initiatives are undertaking. Also, I think an important reminder, Jum, that many of the things that the colleagues are talking about today are not just a good idea, but that there is a global framework with a series of objectives, including a specific objective for states on ensuring access to basic services for all migrants, irrespective of their status. So I think that's an important reminder about the new-ish global compact for migration. So thank you very much, Jum. We have a few moments left for questions and answers, colleagues. So please feel free to write a question in the chat box. Please feel free to raise your hand. Hopefully you can find the location on the Kudo platform for where to raise your hand. It's on the far right-hand side of the screen, I think. Maybe my screen is slightly different than yours, but hopefully you can see that. There are a couple of questions in the chat that I might go to immediately. And then if people would like to raise their hand, we may have time for one or two more questions. There's an observation from Jill Peace that it's very important to have evidence that free, inclusive access to health services is important for public health. And Jill is making the point there that that evidence base can influence and strengthen advocacy for such access. And I think I would like to combine that question with another question by Marilena at the end of the chat, which is, since COVID was a crisis everywhere, how can we ensure that UHC, universal health coverage, is recognized by all states and applied to all in the community, irrespective of their status and irrespective of whether you're a migrant, whether you are a refugee, or whether you're an IDP? So I think combining those two questions, and I would open up to any of the panelists to respond to them, is there an opportunity from COVID-19 and the impacts we're seeing to make a stronger case for more inclusive access to health care, and perhaps even to strengthen the case for universal health coverage? So if any of the panelists would like to answer that question or provide their perspectives, I would invite you to speak now. Jum, I think you are raising your hand, so the floor is yours.
Evidence and evidence and evidence. And with this one, we have to be able to demonstrate that, yes, there is an impact to all population, but this due to their vulnerabilities, heightened vulnerabilities, is affect more, and this population more than others. That's one thing. On the other thing is that we cannot leave anyone behind without vaccinating one group. Every group in that society, they have to be vaccinated in order to obtain the enough immunity to obtain immunity and stop this pandemic. Another thing is that more and more research has to come out on on the also the if the exclusion, that if you exclude them, how it gonna cost the society a lot, gonna cost the country a lot more than what it was if we don't include them. And with this one, I think the number study has started, but I do not see it come out very clearly yet. And then they compare with also the positive contribution by this population. I think something that we have to change the narrative of negative, turning negative narrative into positive narrative, and with that it have to come with evidence. Now in terms of and I thank colleagues who have been, I mean the Red Cross, IFRC and all of this, that have been doing a lot of research on this population. In terms of the universal health coverage, let me go one step further, because you mentioned about universal health coverage. I think the realization is there, and we are getting there, and thanks to all this our global advocacy, but still a lot more to do. But what we see is that it's a lot of wake up call from this pandemic. The pandemic is bad for migrant and for our population, but there is opportunity in there, in the sense that it shows that we cannot neglect this population. And I think it's highlight more and more, and you will see in the new Secretary General report that will highlight the opportunity part that will move us forward in terms of policy changes. We already see changes in policy, for example, universal health coverage for policy, and also on access to health service for migrants in Portugal, in Ireland, and in many countries. And with that, we're going to come out and stand out more and more on the good practice that will move us forward. What I see here also is that when we look now, the European, yesterday I attended the meeting of in the European region to already discuss and develop a new strategy, because the current one will expire next year. The same with our global action plan will also expire. One of their first priority is universal health coverage for our population, for migrant population. Another one that is coming is the Eastern Mediterranean region, where also in this upcoming the committee, the regional committee, going to discuss, and one is they're going to submit the regional framework, and that one, and number one priority is on universal health coverage for this population. So I think it's a lot of positive thing that will come out. So sorry if I answer too long, but back the floor to you.
Thank you, Jum, and you're always allowed to answer long, especially when you have signs of positive hope on the horizon. So thank you very much, Jum. I saw that Jane's hand was up. I'm now seeing it down. I'm not sure if you would like to speak, Jane. Yes, your hand is back up. So Jane? Maybe that's not working. Oh, it's there. Okay, good.
Wanted to weigh in a little bit just to compliment, because it was this concept of building back better. If something has been learned from the COVID-19 pandemic, it has to be that everyone, it's not just the right thing to do, but it's the smart thing to do to ensure that everyone has access to health services and also to the vaccines, as a lot of the people spoke today. The people who are living in the worst conditions, who are the least able to protect themselves from infection, are these most vulnerable populations, the ones who might have the least access to vaccines and be in the greatest need of them, because they can't isolate or distance themselves. So I think so much the lessons from this pandemic should be to reinforce and to get more acknowledgement from states of the importance of universal access to these services.
Thank you very much, Jane. And Angela? Angela would... there you are. Okay, good.
I'm mindful of the time. I think that I just would like to add one point from the ISSC perspective, and that's, I think, when we speak about ensuring access to health services for all migrants, we also need to keep in mind the importance of looking at responses to COVID within a multidisciplinary approach. I think that both the lab report and also the data that have been shared by Jane have very well shown that the reason why migrants may not be able to access services are really varied, and then you can't see only health, in a silos, because there is fear. So there is all issue related to data protection, issue related to, stigma, issue related to how authorities are not able to protect migrants from violence, for example. And on the other side is the huge impact of socioeconomic impact of the pandemic. So also the issue of the need to address this, so that migrants can also have this covered if they want to access health service. So I think it's important to keep this multidisciplinary approach and holistic approach in mind, and looking at it also from the perspective of an organization that works in situation of armed conflict. So when it comes to migrants that are caught in armed conflict together with all the rest of the civilian population, and there are all lot of other issues that need to be taken into account, because we're already talking about health services that have been impacted by the conflict. So there are all these issues about infrastructure. And when you think about vaccination, of course, it's not only the health infrastructure, it's the broad infrastructure to bring the vaccine. So really having all these different aspects in mind. Thank you.
Thank you very much, Angela. And we are just about out of time. In fact, we're a few minutes over. So I would like to just quickly and briefly offer the opportunity to Thomas and to Nick for any final reflections from their side, and then we can quickly wrap up the conversation and this interactive panel discussion today. So Thomas, if you are there and reconnected, are there any final reflections or thoughts from your side? And if Thomas is having difficulty connecting, maybe we can go straight to Nick for any final comments from your side. Nick, to you.
Thanks, Zeke. I just would like to say, I think also related to that question and what we've seen coming out of the pandemic, and also from this research and the different perspectives shared, there's a whole range of barriers that are continuing to exist that pre-existed the pandemic, that have been exacerbated, but there are also opportunities to leverage the work and the evidence and the positive developments that we have seen in policy, and to really match that with the practice through the good work that organizations such as the Fruit Basket are doing on the ground, combining that kind of policy and practitioner research with the evidence. And I think one thing that we can take forward from here, though, is also looking at how do we embed inclusion in policy, in practice, and doing that in cooperation with migrant communities. So that means also looking at the opportunities that have come from this pandemic to maybe co-design research, co-design policies. How do we kind of also bring migrants and migrant communities into the design of vaccine rollouts, in the design of new research? So I think there's really a lot of opportunities to leverage coming out of the pandemic that can all contribute to more inclusive policies now and in the future. But it really is about working collaboratively at that local level, directly with people who are affected, and linking that to our regional and global advocacy. So just some snapshot thoughts from what I've heard reflected on this panel, and also the group of people who are here sharing and listening. So thank you as well on behalf of the lab for the opportunity to share.
Absolutely. Brilliant, Nick. And thank you very much. Thomas, I'm not sure if you're out there, but otherwise, unfortunately, I see there's a few hands up in the audience to speak, but we will need to close the event now because we're already slightly over time. But just from my side as a moderator, I found the discussion extremely rich, extremely diverse, but also in some ways both alarming in terms of the impacts, but also encouraging. We're hearing both of alarming policy and practical barriers, the impacts of those barriers somehow connected to the COVID pandemic, but also more structural and more and pre-existing the pandemic. And I think we have an important opportunity to see these impacts, to make them visible, and as Jane mentioned, to build back better and make sure that these are addressed before any future public health emergencies or other crises that we may see. So we are seeing the alarming impacts, but we are also seeing some positive developments that have been well highlighted. But we also have heard from a diverse range of policy practitioners, people working at the local level, people working at the global level, and it makes me feel encouraged that there's a lot being done. There's a lot of initiatives. There's increasing attention to this issue. There's an increasing commitment to this issue. So I think we should be both concerned but somehow encouraged at the same time. In terms of next steps from this event today, the recording of the event will be shared with you. So hopefully you have an opportunity to receive that recording from the organizers of this event. Many of the reports and research and analysis has been shared in the chat function. I'm sure that will also be shared with you directly by the organizers. We have the report by ICRC, we have the reports by the IFRC and the Global Red Cross Red Crescent Migration Lab. We have the dashboard with a lot of important findings, research and analysis by the Mixed Migration Center. Hopefully Jum can also make some of the resources of the UN Migration Network working groups and thematic focus available to colleagues. And Thomas, hopefully you can also share a link to the work of the important work of the Fruit Basket and how people can find out more about the work of your organization. So with that, I would like to say, please keep up the excellent work, everyone. I certainly have come away from this event encouraged. I hope that many members of the audience also feel inspired by some of the positive practices that we've heard about, some of the positive policy developments that we've heard about, but that we also have a clear roadmap forward and what more needs to be done despite some of these positive dimensions. I think, Nick, the lab would normally close this event, but just to reinforce, because we don't have time for a colleague from the lab to take the floor, just to reinforce for the new Global Red Cross and Red Crescent Migration Lab, the focus will continue to be on working together and across partners, policymakers and practitioners, and specifically the recommendations and the ideas shared during this session will be built upon, they'll be incorporated into the work of the Global Red Cross and Red Crescent Migration Lab, who will continue with the ambition and the objective to connect local evidence, connect the voices and experience and knowledge of communities directly affected with national, regional, and global policy discussions and the important advocacy that must continue. So with that, thank you all for taking the time out of your days, your mornings, your evenings, for joining this global panel discussion. Thank you very much for the active participation. A very big thank you to all of the panelists who have joined today and have presented excellent work. I would once again encourage you all to go and look a little bit more deeply into the research, the analysis, and the findings and the activities of many of the initiatives that we've heard about today. So with that, we will draw this event to a close. And once again, thank you all for your time and thank you all for the active participation.